Here at Opioid Addiction New York, we want to stress the difference between dependence and addiction. Dependence is the tolerance one develops over time and the withdrawal one suffers after stopping a drug. Addiction is a behavioral disorder that refers to the desire a person feels for the effects of a drug and the loss of control over their lives that they have in order to obtain it. Today we'll be looking at the treatment options available to those who are addicted or dependent on opioids. A drug addict, unfortunately, spends much of their day either high or sick. The goal of pharmacotherapy to help with addiction is to reduce the amount of time spent feeling sick without achieving the high. Unfortunately, we don't use this kind of therapy as often as we should. Another reason is that therapy isn't well understood. Some people think that using drugs like methadone or buprenorphine is just swapping out one addiction for another. The media hasn't always helped with this perception. The best way to treat addiction is to prevent it. We all knew that too many prescriptions for opioid painkillers were being written. Policies were put in place to try and reduce the number of unnecessary prescriptions. Another issue is that many still feel like drug addiction is a moral failing rather than a personal and public health issue. Usually, treatment begins with detoxification, where we try to beat the cycle of withdrawal. It often continues with rehab, either in the inpatient or outpatient setting, often with pharmacotherapy as well as behavioral therapy. Behavioral treatments work to help patients learn to live without drugs, to overcome cravings, to avoid situations that could make drug use more likely, and to deal with relapses. The objective of treatment is to reduce dependence on drugs, to reduce morbidity and mortality caused by them, to improve mental and physical health, to prevent illicit behavior, and to help people re-enter society. Naltrexone is an antagonist medication, which means that it blocks opioid receptors. When someone is given naltrexone, then the opioids don't really work. It can treat both overdoses and addiction, although it's not as widely used for addiction as people don't take it consistently or tolerate it well. If you stop taking it, you can also get high soon after. Methadone is a synthetic opioid agonist, meaning that it works much like opioids do. It acts on the same receptors in the brains that the other opioids do, and in doing so relieves withdrawal symptoms and reduces cravings for the drugs. Methadone is one of the most popular forms of treatment for addiction. Buprenorphine is a partial opioid agonist, meaning that it works both a bit like an agonist and an antagonist. It also reduces cravings and decreases symptoms of withdrawal. A number of randomized controlled trials have shown it to be significantly better than placebo. But the drug is materially different than illicit opioids. One formulation, Suboxone, differs from other buprenorphine regimens in that it combines naloxone in the formulation, making a euphoric experience from either the buprenorphine or any other opioid pretty much impossible. It's important to remember that addiction leads to real changes in the brain. Withdrawal leads to real symptoms, including diarrhea, abdominal pain, nausea, vomiting, aches, pain, and changes in mood. Those are just words, though. The agony of withdrawal is very, very unpleasant, and people will do almost anything to avoid it. Finishing detox relieves the physical effects of addiction and withdrawal, but it's the social factors and psychological effects that lead people to relapse. Long-term maintenance therapy can help. These can include cognitive behavioral therapies, like the SMART therapy program, motivational interviewing, and family therapy. Opioid abuse has become such a big problem that treatment is very, very important. Given the significant relapse rates, though, we need to continue to look for new and better ways to treat addiction. Overcoming the stigmas attached to treatment is a good start. Understanding addiction as a change in brain structure rather than a moral failing is essential. We also need further research and improvements in maintenance therapies and improved access to the treatments we have. If you or a loved one is battling opioid addiction, do not hesitate to give us a call or even a text at 1-888-995-3405 or visit our website at helpwithopioidaddiction.com. We offer both telehealth appointments and in-person appointments at our discreet, high-end office located at 245 Fifth Avenue, NYC. There are absolutely no signs for addiction medicine, so no one will ever know why you are there. You deserve to be treated with respect and dignity and not have to deal with the stigma of addiction medicine, so please come visit us when you are ready. Remember, the journey to rehabilitation begins with the first step. Let us take the rest with you.